I think we can take questions, and please direct your questions. If you can introduce yourself, and we'll take it from there.
It is the government has gone wrong many times. It is the private sector has also gone wrong many times. The question of land has been issued number of times, and the government is feeling it. There are 11 cases with public interest litigation in High Court where obligation of that hospitals taking land for 1 rupee per square yard has not been done. And now they have given an affidavit, they're ready to pay the commercial price. So there are wrongs at both the ends, and that is why government is very skeptical not to give the land bank free of cost. Second is 90% of preventive and promotive budget in the India is by the government sector. NGO does 3% of private sector in terms of, I'm talking about preventive part. So let's find what is wrong with the private, what is wrong with the government. I have been critical to the government. I was myself in the government for 38 years, heading the Navy Medical Service of India. And let's bridge the gap. Thank you.
Just in response to what the learned gentleman has said is that I think the onus is on the government to implement the criteria. So if a particular hospital has been given land at 1 rupee per square foot and they are not doing 10% of your inpatients and 20% of your outpatients or 25% of your outpatients free, wait for 6 months, wait for a year, cancel the lease. If that's not been done for 10 years, it's not the fault of the other private players who want to do good for the country. The government should take a strict stand and say, okay, if you're not fulfilling your obligations, we take the land back. On the other hand, there are other private players who spend many hundreds of crores of rupees just to procure the land. Why should they be penalized? Either for the cost of the land or again then for doing free treatment. The onus is clearly on the government to implement. And I think if the government comes down strictly and sets one case example, a lot of the players will be straightened.
I think just to add on what Dr. Bagai out here has mentioned, we all are aware of that there are many cases in Delhi currently where there is a allocation of land given for particular purposes. Many of those cases even today seem to continue to go on. And what's happening is that the good guys as well as the people who don't follow the law are getting equated together. And it creates a further mess for everyone. So I think there's a need for us to, a need for the government to ensure that those who follow the law need to be given appropriate steps.
My name is Vipin Mahajan.
See, one of you commented about different hospitals. They could bunch together for the purpose of governmental taking health tourism and things of that kind. I have give you a very good idea. IT industry did what you call much before, very early days, somewhere near 89. The IT industry players came together for set up NASSCOM. NASSCOM was their own association. This is the best association in the world. They were proactive. This is so-called, they ensured that is seen as a self-regulating mechanism. The idea was, we will ensure that project a picture by which government doesn't have to interfere. So progressively, Department of IT or Government of India itself didn't have to interfere. And on the other hand, they could become such a powerful body to talk to all the way to everybody from Finance Ministry to PMO to everybody, projecting a very good picture. So much so, including in US, whenever there is an outsourcing problem and things like that, congressmen and things like the lobby, etc. So I think it will be a good idea if all of you form together some kind of a association properly, a good cooperation, some of you stalwarts taking a lead role. It might be a very smart idea because you are in that stage, early days. But if you can't pull together, that's another issue. Second, hardly 2 days back, there was a news item about Lancet about, that's well known. Some of you, I don't know whether this session is meant only for private sector for tertiary care. But I think a lot of good ideas came around. How about primary and secondary? Would you like to play an overall role about improving overall health care beyond tertiary also?
Yeah. Let me address the first comment and question which you made. we are actually in the process of establishing something like that in the IT. But there's one difference. When the IT industry came from the private sector, there was no government role or play in the IT industry at that stage, right? In little amounts, but not that much. Whereas government is a very entrenched provider of healthcare in India, and it's very significant entrenched at a primary, secondary, and tertiary level, and definitely at the educational level. So, any kind of a health industry focus has to definitely incorporate all sectors of the government, and unfortunately, healthcare is implemented at a state level by the government, right? And at a central level on a policy, and has multiple ministries which are involved in the process of healthcare. So I think there are various, but that's happening. The other issue is that, you know, it's a misconception to think that private healthcare is not in primary and secondary, right? Because tertiary care is part of the continuum of primary, secondary care, right? And there is no hospital, I think, which provides tertiary care which does not provide primary and secondary care. Whereas there are many hospitals which have got, private hospitals, which have gotten into the secondary space only, right? And that means they provide primary and secondary care. Columbia Asia is a typical example of those kinds of hospitals all across the country. So private healthcare is definitely looking at primary and secondary. You know, there is an issue in India which has to do with pricing, right? And that is what causes, and I think what we've all been talking about is what raises the price is the cost of delivering a product. So if the product cost is extremely high because of various factors, I can't do very much to the cost of an MRI or a CT machine. But we've been talking to our manufacturers that you've got to have an Indian pricing structure which has to be different than somewhere else. And as more and more hospitals come in, I think we'll see something like that happening. But this is an issue which we have to look at. But we are all in the primary, secondary space. So, and I think that it's the other point which I want to bring out is that we will be completing our 2 PPP hospital projects in Punjab, one in Bhatinda and Mohali, by July, September of this year. And these are PPP projects. So far it seems to be working fine. We'll let you know in a year or two how well they're doing. So, but they are true PPP projects and in tertiary space as well as secondary. So government is also trying to do something, and I think state initiatives make a difference. So you'll find a big disparity between, let's say, Punjab, Gujarat, and maybe now Bihar is an opportunity to look at.
Error-free drug administration system that you're talking about. What I understand, there is a unit dose drug delivery system, which is now being probed and investigated by WHO also. And there are quite a few hospitals in the US that have adopted that, but they're basically electronic robotic management system by picking up drugs, individual drugs, and putting them together as what we call unit dose delivery system.
Yeah, it requires a unit dose dispensing, it requires a generic inpatient formulary, it requires a barcoding of patients as well as barcoding of the unit dose sample, and then the appropriate identification that the right patient is getting the right drug. So that means you need mobile, either Samsung or iPads or some kind of devices which can actually be taken at a bedside and be done. So it requires a number of different hardware. Software solutions are available. It requires the process. One big thing which it requires is the ability for bulk drugs to be made available. You know, today, unless you buy generic drugs, they come in strips, right? And that causes a problem. So there is a huge amount of, let's say, regulatory change which is required at the pharmaceutical oversight for bulk dispensing. So if it comes in a box of or a jar of 100 tablets, it becomes easy then to be able to dispense it to 100 different people, right? Otherwise, you have to do strips, and that causes that itself is an issue. So the important thing is that the hospitals have to create a generic drug formulary, right, which then gives you a bulk purchase of medications, and then you need a bar coding system with an input at different levels so that the right patient gets the right drug. And you can do it for anything, whether it's blood administration, whether it's drugs, syringes, anything.
So, a little response, I mean, maybe a clarification. One, when we look at the land issues, we probably only look to Delhi. We do not look to rest of India. Second, in the debate between government charging and providing free land for healthcare, at one time crying that there is shortage of beds, and at other, I mean, making the land costly or paradoxically, I would like to agree to Dr. Bagai. I mean, though it's a paradox. In fact, the melody is a little higher. Sir, एक minute. The melody is a little higher. Melody is the monopolistic status of land development and allocation in Delhi by DDA. That is the government. Okay. Had that monopolistic